In this video, I would like to talk about what is important in the OSCE or clinical exam. Most of the doctors or students, what I've noted is they are not focused on the task. They get distracted. I can understand it because you're under a lot of pressure. You are worried about what happened in the previous scenario, what will happen in the exam. Will I fail this exam? Will I pass this exam? This is what is going through your mind, and you will stay out of the track. So one thing you need to understand is you need to be focused to that particular task. Don't think about what happened in the previous one, what happened in the past scenario. So this is what I used to do. When I was preparing for my clinical exam, I used to take one task at a time. I never look at it as a 16 case exam or a 12 case exam or a 10 case exam. Any exam I do, I go with one task, this station. I'm not worried about any other station in the OSCE or clinical exam. I only focus on that station. In that station, I only focus on what are the tasks that are important. Don't think too much. If they say take history, focus on history. If they say counsel the patient about contraception, just stick to that. Don't get distracted. Don't ask any history. Don't do any examination that will not lead you to that particular scenario or the task, because you will not get any additional marks and you will waste your valuable time and you will probably fail yourself. So let me give you an example. If the scenario says a 58-year-old man had a fall at work, has come to you, take history, do focused examination, manage the patient. So it clearly tells you that this patient had a fall. You have to examine, take history from the patient, you have to examine and manage. So this is very, very important. And if they say this patient had a fall at work, that means it's a work injury, which is a compensation problem. So you need to cover that as well. I know it's a very small thing, but these are all important things where you need to give a work cover certificate or a work injury certificate that is slightly different to the normal certificate. So if you are practicing in Australia, you need to know the system and what is it that is expected from you in that particular task. Any final year medical student or fifth year or fourth year student, when they do observership with the doctors, they learn all these things. So it is your duty to know all these things as well. So stay focused to the task. Ask everything that is relevant to the task. Don't ask anything that is not relevant to the task. The same thing applies to the history. Examine the patient that is relevant to that particular scenario and do any relevant examination. The same thing with the management. Focus on what is important in the task. For example, let's say this 58-year-old man had a pain in the arm. So you need to do an X-ray because he had a fall and the fall happened at work, and you need to give him pain medication and you need to treat the case. You are not asking about STD history in this case. So don't get distracted. Ask what is relevant, and if you believe anything else is relevant to that, ask it. Don't ask anything that is not relevant to the case. Don't waste your valuable time.